What is a patellar dislocation and what can you do about it? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on sports and exercise injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Now, a patellar dislocation, people often call a knee dislocation, but that's not really accurate. A knee dislocation is really what we call a multi-ligament knee injury, and we'll talk about that next week. With a patella dislocation, we're talking about the kneecap popping out of place, and it's fairly common, especially in young athletes, especially female athletes. You know, you twist awkwardly, and then all of a sudden your kneecap pops out to the side. Sometimes it pops right back in. Sometimes you actually have to go to an emergency room or have somebody pop it back in place for you. Now, fortunately, if it's your first time with a patellar dislocation, a lot of times you don't need surgery. Sometimes it's as simple as, going to the doctor, finding out what it is, but then doing some work with a physical therapist to regain strength of the muscles around the knee, maybe wearing a brace for a short period of time and giving overall your knee time to heal. And that may be enough to keep it from happening again. But sometimes it does end up happening again. And if it starts happening over and over, especially when you've done a brace, and especially when you've done physical therapy, yes, sometimes that needs surgery. Now, some people are more likely to fall into that group depending on the alignment of your knee and maybe the alignment at the hip. Some people that are naturally sort of ligamentously lax, or some people say double jointed, but have kind of stretchier ligaments, might be more likely to do it. Sometimes it just happens for whatever reason, and once it becomes a recurrent problem, a lot of times even things like physical therapy and a brace aren't enough to keep your kneecap from sliding around, partially sliding out of place, what we call subluxing, or completely dislocating, and so surgery can be an option. And then surgery really depends on the exact nature of your knee and what's going on, but it may be rebuilding the ligament on the inside of your knee, maybe even involve making cuts in the bone to fix the alignment issues. So there are some things to think about there. Hopefully you can get over it without surgery. Even some first-time dislocations need surgery though, especially when it pops out of place, you knock off a small piece of bone or cartilage. So worth going to the doctor shortly after it occurs, find out the nature of the injury, sometimes even get an MRI, then see if rehab, physical therapy, and a brace is the right way to go, or at some point you're ultimately going to need surgery. All right, have you suffered a patellar dislocation and how did you get over it? Did you need surgery? What was the workup process? How did therapy go or the brace go? I'd love to hear your experience. So in the comments below this video, feel free to describe it so I can learn and we can all learn from your experience. I can't respond to specific questions that you leave there. Maybe I'd try to answer those in an upcoming Ask Dr. Geyer video, but I'd love to hear your experience. Now, I'd also love to help you overcome your knee injury. In the description below this video, the very top link, if you click on it, it'll take you to a page where you can answer several questions that will help me give you the #1 next thing to do to overcome your knee injury. Again, that's in the description box at the very top, and that can help you. If you like videos like this, and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my video channel. I record several of these videos every single week, so click the subscribe button in the upper right corner of the page. They'll get delivered directly to you. Thank you so much for watching. I hope this video helps you overcome your patellar dislocation, your kneecap dislocation, and I look forward to seeing you right here next time.